Now we're going to be talking about the Pindex instrument and the Pindex type model. So you see this is pin that has a retentive segment and then a little bit enlarged part to help to fit. And this is the same thing about the drill. The drill creates the same profile. The active part will drill a hole in what will be the mobile die. So there's one drill for one type of pin, so you can't mix them. Yeah, although many technicians do mix them up, but normally you have to have the drill corresponding to your pins. And this is the device. You see the laser sits right on top of the drill. So now you know exactly where you will drill. And once you are on top of your die, you simply press and you have it drilled. The pins, they have a Teflon margin or holder. So that's why the technician uses 2 pins for each die. And the rest of the model is kept in place by 2 pins, as you can see here, but they don't have to be close to each other because that part of the model will remain in one piece. So you see those that will be mobile, they need 2 pins. The rest of the model needs just 2 pins for the hole, one side, the other side to hold everything in place. Because this will be now cut. So you can imagine easily that this has been poured into the impression, then trimmed to look nice and flat like this. Then the Pindex was used to create those holes. And now you see the pins that will be fixed. This is cyanacrylate, super glue-like liquid. And the technician places everything there, checks that it's clean and the hole is empty, no debris inside. And then the technician would place all these pins in position. You see, the technician started with the zones corresponding to the margins of the model, the extremities of the model, and now when everything goes nicely, there's the moment when the technician will place the pins in the part representing the mobile dies. Cleaning, of course, the excess of cyanacrylate. Again, checking everything and then putting everything back in position. So now everything is fit, it's level. 2 more pins to be applied. We allow everything to set, and then we have to isolate or to insulate the plaster in order to avoid it making contact and setting together with the second stage of the producing of the model, the plaster that will go in this tray. So everything has to be isolated. Now the Teflon holders will be placed on the pins, and you understand those Teflon holders, they have a clear position. There's an up and a down. If the two pins are very narrow, the flat surfaces that they have will give us the possibility to still connect them to the same die. Right, so one more to go, and then obviously we'll have the plaster in the tray, and then we put that the model itself. Now we use a split. What is this split? Is a magnetic connection that will remain in the plaster representing the base of the model in order to allow us to remove the model from the articulator. So this is the split with a metal part that sticks to the magnet there, and the blue part will be fixed to the articulator. So now the technician is checking whether the model sits nicely there, which yes, it is the case. You see, this part of the model has to be non-retentive, no undercuts, because then we'll have to remove the mobile dies from the system, from the base. So now the technician is using third grade plaster to produce the base of the model. This technician is a very accurate one, measuring exactly you see, how many grams? 15 grams, so, sorry, 150 grams. So the technician knows exactly how much plaster there is inside, and she knows now exactly how much water she needs to pour. She will definitely measure the quantity of water. This is very important to get a plaster that did not dilate too much nor contract too much. The ratio between powder and water is very important to control the behavior of the plaster after setting. So now again, the hand mixing, that's what we start with. And then the vacuum mixer. And the pouring of the plaster. You see, there's no need for vibration. Technicians who know how to do it, they really do it without vibration. And now we let the plaster set, like 40 minutes. And then we remove it from the model tray. And then slowly, we remove the plaster base from the plastic holder that has also the magnet in it. That's how we do it. So the magnet goes back. And now we will trim the excess of plaster. That's a trimmer. It uses water, obviously, because otherwise there will be a mess with all the dust. So we do it until we touch the part representing the arch. So this is how it has to look, not otherwise, right? That's how it has to look. And here you have to pay very much attention not to trim the teeth themselves. If you do, it means that you positioned the impression or the model, you positioned it wrongly when you did the pouring of the base from the very beginning. So now the model is ready. You can tell immediately with such a model if the abutment has been replaced correctly, fully down or not. And now we let everything dry. We remove now the base from the arch itself. You don't have to wait too much till you do this. You have to do it quite quick because the plaster dilates all the time. So as quick as possible, you have to cut this dies, this individual dies. And you see the technician avoided getting with the cutter in between the teeth, not to damage anything, preferred to break a little bit the plaster at the end. Now the technician must clean everything and dry everything, make sure there's no powder. And now all the components can be placed back. The powder, this powder has to be carefully removed because otherwise, you imagine, the model will not go fully down. Yeah, all those components, and when you want to check the occlusion, one part will be higher, so it will falsify the whole measurement. So now you understand why we needed that visible perfect contact between the two types of plaster on the labial, to make sure now that we really place them fully down when we place them back. And yes, the individual abutments, they have two pins, and there's this Teflon holder inside the base. So this is the split of the model. And this other part will sit on the articulator. There, up there, will be the articulator. So you can check the occlusion. Yeah. But when you want, you can remove individual dies just like this one. And now we do the ditching. So you have to remove what represents the gum in order to clearly see the margin of the preparation. So this is a ditching, and we only remove the gum. Again, that should be done under magnification, and a good dentist will provide the technician with a good impression so as the technician will be able to read correctly the margin of the preparation without doubts. Again, the vacuum is on, as we have seen before. And now it's a critical moment because the technician is close to the preparation margin, to the margin line, or as we call it in English, the finish line. It's the margin of the preparation, or intraorally it is called the finish line. So this has to be done very carefully. Normally you do it under microscope, again. So there you see clearly the margin. The impression went under the margin of the preparation, which is now seen. So there you could remove more or less because the margin is already seen, clearly evident from the very beginning in the impression. So once you did that to all the abutments, you clean them thoroughly, of course. We don't want to have powder remaining there because this will modify the position, obviously. So you see, technicians have to be very careful with all these stages of their work. Blows air on it. And now you see the pencil is marking, actually it's the margin of the pencil, the flat part, not the tip, the flat part, yeah, the cylinder part of the pencil is intersecting, is finding actually the margin. And this pencil is using a wax marker. It's not carbon. You see, it's red, and it's wax. Why don't we use carbon? Because in the case you would like to do, if you want to do a gold restoration, that carbon will interfere with the gold when you cast the model. It will remain on your pattern, and it will impurify the restoration. So what the technician is doing now is applying a little bit of wax to soften the margins, right? To make them rounder. Yeah, indeed, in that place, the crown, the pattern will be at a distance from the abutment in the mouth. That's true, but it is better like this. Otherwise, you will have contacts, and the dentist will not be able to fully sit the crown on the abutment. So what this technician is doing is very important. All those small, tiny details, they're not important. The dentist shouldn't have left them there, but in case the dentist did, the technician has to very carefully close those undercuts and those sharp margins. But we don't touch the margin itself, right? That's very important. There we have to close perfectly, yeah, on the original. But here we're not interested to, we can have more space. Actually, we do apply even a spacer afterwards, so it's no problem. It's okay. It's even recommended to do this. This is the secret why some technicians send you crowns that fit easily, and other technicians send you crowns that you have trouble, placing them on your abutment. And now the spacer. The spacer is meant to create in between the pattern, the wax pattern, and the die, to create the space that will be later occupied by the cement when the dentist is cementing the crown in the mouth. So you can see this as the correspondent of the cement. Yeah, it has like, between 7 and maybe 10 to 15 microns per layer. It's kind of thick. This type you only need to apply once, but in other cases you need to apply 2-3 layers of spacer. So now it's the die is ready to receive the crown. Well, actually to create on it the wax pattern of the crown, to wax up the pattern of the crown.